Starting Point Coaching and Consulting presents Kairos Conversations, Connecting with Quality, the podcast. Kairos is Greek for the right time, the right season, the right opportunity. This podcast features healthcare quality professionals who share their journeys, their advice, their struggles, how they made that transition into a new and exciting role. My heart's desire is that you find this podcast to be inspirational to you as you make your own journey. Don't forget to share this podcast with your colleagues and friends and rate us on whichever podcast platform you listen to. Thank you for being here. Thank you so much for tuning in today. Today, I am joined by my next guest, Tesiah Coleman. Thank you so much for being here, Tesiah.
Thank you. I'm very excited to be here today.
I am super excited. So let's start by introducing yourself to the audience.
Sure. So I'm Tesiah. I use she, her pronouns, and I am a nurse practitioner as well as a doula and a lactation counselor. And I'm the founder and CEO of Togather.
So you are my first doula and lactation counselor that I've had on this podcast. So I'd love for you to share what that means for people who think they know what you do, but don't really know what you do.
Sure. Yeah. So I'm a little bit out of the direct care game in those sense. I mean, actually in all senses right now, I don't provide direct care, but I started my journey as a lactation counselor first from my own experience of breastfeeding my son and needing a lot of support. And so that the way being an LC looked for me was working with families pretty early after delivery, going into their homes and providing them with support on feeding their babies in the way that they wanted to feed them. And so that could look like full breastfeeding support or partial along with formula feeding. It looked in a lot of different ways, but it was a really amazing way to connect with folks during a period that sometimes people feel a bit forgotten or isolated. And so that's what I did as an LC. And as a doula, I actually had a little bit of a non-traditional doula path. So I got into it supporting women at a women's facility where they lived with their children or they were pregnant and they had substance use disorder or mental health diagnoses. And so I would go to the hospital with them and support them during their births. And they lived in this residential facility. So that was right out of college for me. And so I became a doula through that. So I did that work in Boston all throughout becoming a nurse practitioner.
So were you a doula? I know you said you started lactation as a result of, your son's birth and all of that, but were you already a doula at that point, or did you kind of do both at the same time?
So I was an LC first and then became a doula afterwards, where I saw kind of more of the connections, like just saw that it was happening way before postpartum. Like it was, the education needed to happen really prenatally and through birth, like that first hour after you deliver has a really big impact on your breastfeeding experience. And so that kind of led me to being a doula as well. And then that opened up the world for me of lots of different birth work. There's end of life doulas, there's lots of different kinds of doulas.
Wow, I didn't even know all of that. I mean, I could see why the support would be needed, but I didn't even know that existed. And best practice in a lot of hospitals is, to get baby to mom as soon as possible, to have that skin to skin and to breastfeed exclusively. And I know it can be hard for a lot of women, including myself, when I had my son, to breastfeed exclusively because it's not as easy as people make it seem like it is. And, if the mom is not producing like she wants to, or for the baby's not latching, or a lot of other reasons why moms struggle with breastfeeding, but having that support from a lactation consultant, a lactation counselor is huge.
Yeah, it really can be. And, I think about breastfeeding as being natural in the same way as maybe speaking is or walking is, where it's like, of course, like many of us can do it and it is kind of a natural progression to do it, but it doesn't mean it wasn't hard. It doesn't mean we didn't fall down a lot when we were trying to, didn't mess up our words. Like it's a process. And so the same thing with breastfeeding, it's a process and you need support with it. We didn't just like wake up knowing how to walk or wake up knowing how to talk.
Yeah, it's definitely a learned skill. So you say that you don't practice clinically now. What do you do now?
So kind of after that, I went on to become an NP, and I worked as a nurse practitioner doing direct prenatal care in community health, and then moved into health tech, doing kind of director level clinical quality and virtual team building. And so now I kind of think, I guess my role is kind of three parts now. So I do clinical education design. I do that both at Togather, which is a community for healthcare providers dedicated to justice, and do that for Togather, but I also do that for other companies. And so they'll maybe hire me to help streamline their clinical education or help build out clinical education, do webinars, courses, things like that. So clinical education design definitely is in my wheelhouse right now. But most of my time is spent as both a community architect and as a cheerleader, basically, cheerleading other healthcare providers and supporting them to be able to deliver on their goals and do the work they want to do that's so important, but they maybe don't feel like they're doing sustainably right now.
Right. And Together really focuses on health justice. So can you explain the difference between health equity and healthcare justice?
Yeah, so I would say we do a little bit of both health equity and health justice. And health equity, I more think about supports, like having supports in place to help people get where they need to go in a system that's not made for them or not supportive of them by design.
Mm-hmm.
And health justice, I think of as the working to dismantle the system that isn't made for them and made for them by design, and trying to build a better system altogether. And so we do a little bit of both work at Togather, and really like Togather's role is to support the healthcare providers who are working towards that goal, both support them personally and professionally so that they can work towards equity and justice.
So what really got you passionate about this work?
Oh, my whole life. Like, really like a very personal work for me. Like I mentioned, getting basically all the work I've done has been personally driven. And so something happens in my life and I'm just like, hey, this isn't right, or I want this to be different. And so I focus in on that. And so, for me, when I was providing breastfeeding support, I noticed a lot of racial disparities in rates of breastfeeding. And so I started to do more research on that, and I started to give talks about that. And so that was kind of also my first entrance into the clinical education and curriculum design space, was through racial disparities in breastfeeding. That's what my focus was and my research passion was. And so I think that that's probably where it started for me. And then it just evolved from there of like uncovering. I kind of talk about health equity work. It's like once you see it, you can't unsee it. It's like then you just see it everywhere. And I truly did see it everywhere. And then I was like, oh, let's pull back this curtain. Let's pull back this curtain. And everywhere I went, including all through NP school, I kept uncovering more and more and trying more to get to the root of problems, and feeling like really we need to unearth what is causing all of this and work towards fixing that. And that is what really made me passionate about health justice work.
Okay. And how do you support professionals through Togather? And why do you call it Togather?
Yeah, so Togather, man, it was a journey to that name. But it really is like, it's one of those things where it's like the simplest thing ends up being the best thing, which is like, what are we trying to do here? We're trying to gather together to amplify our impact and to support each other. And so it's simply that. We are here to gather. And so that's what Togather is. And then there's also just like a bunch of fun puns you can make with the word, which is always fun for me. I make a lot of them. And with Togather, so Togather, I kind of think of as supporting like what you would need when you were going to run a marathon or something. And I always caveat that with the fact that I'm actually not a marathon runner. So like maybe this is probably inaccurate, but when I think about a marathon, I think about needing to kind of train your mind and body ahead of time. And so with Togather, we do that for healthcare providers through our education pieces, our courses on various health justice topics. We would take a really practical approach to it. So it's not just like never ending like pages and pages or lectures and lectures on the problem, but it's more so focused on the strength, resilience, and practical ways that healthcare providers can address these problems. So that's kind of the training aspect. And then once you are actually running the marathon, you really need people on the sidelines cheering you on. And you also need those people who stand with the little snacks, like the waters and
yes.
the oranges and stuff. And so that's also together. So our snacks are these virtual events that we have. So we have a traditional Chinese medicine doctor Vignette Ching, who does amazing work around how to really empower healthcare providers with their own toolbox to care for themselves and tend to themselves in a lot of embodiment work around health justice. And so we have events like that, mindfulness events, ways to just connect and talk and network with each other. So that's like the little snacks to keep you nourished along the way. And then we also have the cheerleaders, just a community where you can jump in and you can ask a question, you can be supported, you can post a amazing thing that you did that you just want someone to recognize and understand how hard it was to get to that point. And so we're all of those pieces to really just holistically support healthcare providers in being able to do the work they want to do without sacrificing themselves along the way.
Yeah, because continually sacrificing yourself or being in a situation where you're in a space that was not made for you and sometimes doesn't want you there can cause some post-traumatic stress.
Absolutely.
I mean, literally, like PTSD, like it's not just, oh, I'm bothered by it, but, it can be very all-consuming when you're in those kind of environments and you don't feel like you have the support of people who understand.
Yeah. And I mean, there's a physiological effect to that. Like there is the wear and the tear on the body that happens when you're repeatedly exposed to those kind of traumatic events. Even like, some people will talk about like big T trauma and little T trauma. And it's like, if you are repeatedly exposed to little T trauma, just like these small things that healthcare providers sometimes experience every day, and certainly healthcare providers who also hold any intersections of marginalized identities, BIPOC, LGBTQ, neurodiversity, all of these different intersections. Like when you're constantly exposed to someone saying something, someone doing something, getting passed over for a promotion, these little, in quotes, things that causes this chronic stress that has measurable effect on your longevity and your quality of life. And so I think that experience of moral injury kind of is the word that the latest word we have to really describe what happens to healthcare providers. That moral injury can just be devastating to the personal and professional lives of healthcare providers.
Yeah, absolutely. So with the supports that you offer, do you find that it's helping people to have a sense of belonging?
Yeah. I mean, I actually witnessed this amazing, I say witness because, it was in the community, but I wasn't part of the conversation, but it was this awesome conversation with this new member yesterday in which her and another member were just bonding over D&D, Dungeons and Dragons. And they were talking about how it's such an outlet for them in just having a place to kind of like escape from it all, like be seen, have fun, like so many different things. But then they were making all these incredible connections to like justice work and experiences they have as clinicians. And there were different kinds of clinicians as well. And so I thought that was so beautiful that they were able to connect over this thing that we are not really encouraged to talk about in practice, right? Like we're kind of told to leave parts of our humanity and ourselves at the door when we are clinicians. But it's like we're whole people with hobbies and interests and things that make us laugh and things that make us cry. And when we're continuously told to kind of leave that outside, it wears on our compassion and our ability to be human in the exam room or in the interaction with the patient. And so really trying to encourage folks to bring all of themselves into the Togather community. And nothing is really off limits as far as what we talk about and what may be covered.
Yeah, so it's a safe space, I'm assuming.
Yeah. And we kind of talk about it as being kind of beyond a safe space. It's an empowered space. So like you might have an experience in the Togather community where you feel uncomfortable because it's uncomfortable to talk about racism. It's uncomfortable to talk about our very broken, failing healthcare system. But that discomfort leads to amazing growth opportunity and connection between people when you can be seen and move through that discomfort in a way that you feel empowered to stay with it and to keep trying and to keep growing. Like that is really where I've seen some of the most beautiful change happen.
Yeah, and I'm glad that you brought up the fact that our healthcare system is broken, because it is. So what do you think would make healthcare better for our patients and more sustainable for our colleagues?
Yeah. Oh, that is the question.
A loaded question.
That is the question. So I think honestly a lot of things, and I think nothing quick. And I think that that's honestly the thing that people have the hardest time swallowing is like, we didn't get into this overnight. Like this has been a long drawn out process of a lot of poor decision making and a lot of hoarding of resources into certain groups or certain people or certain industries. And so it isn't going to just be like, this is the one thing that fixes it. But I think a sustainable, concerted, community-based effort is really what is going to turn the tide on things. That is what I'm trying to create with Togather. But I also see that in so many other communities that are being created, so many other community health work, like just grassroots work, where you're actually giving power and resources back to the communities that are being most affected by our healthcare policies and the cracks in our system. And so I do think that looking to the communities that are affected the most is where the answers lie. And I think that that's what I love the most, honestly, about health justice or health equity work, is that like everybody wins. Like when we support folks that are losing the most, that are having the hardest time, everybody wins from that. And so I think that can cause just such an amazing domino effect that I'm excited to see as we see more of this work being done.
The biggest mistake I see clinicians make when transitioning away from direct patient care is applying for every available role. Problem is, it's like throwing darts at a board, hoping something sticks. And let's be real, employers can sniff this out like a canine, and it makes the candidate come off as unfocused. The solution, my friend? Do some deep introspective work to identify your passions, skills, and strengths, and find roles that align with that. That's why I've partnered with Career Clinic, who created the healthcare career profile that I wish I had created first. It's called Stream Ahead, and it takes about 10 minutes to complete. It is time well spent to get detailed report of the top work streams that fit who you are. I'll link the assessment in the show notes section of this podcast. And you can use the code BRANDY10, that's BRANDY10, for 10% off. Now let's get back to today's episode. So for people who are listening who want to get involved in community-based efforts and want to be a part of creating a more sustainable healthcare system through health justice, how do they get involved? Like, what's the next step that they take if they say, I want to be a part, it seems overwhelming, I don't even know where to start?
Yeah. Yes, that is the thing, is that it is, I think, first of all, just acknowledging, like, it is overwhelming. Like, there's an overwhelming amount of bad things happening in the world right now. And so I think just like naming that and acknowledging that that is the case is a good place to start. Then I think that deciding what you want your thing is, like, what is the intersection of your skills and your interests with, there's like no scarcity of work that needs to be done or problems that need to be solved. And you alone can't and don't have to solve every single problem. And so what are the problems you are interested in solving? What is the work you do feel like you are capable of? And then plug in with other people doing that work. And I think that is part of what I'm trying to create together, is just a meeting place for folks to connect with other folks doing the work that they're interested in. Because like, as for example, like I had a rotation in school in a prison, and that was really confronting to me. Just the state of healthcare in the prison system was really, really overwhelming to see up close and really sad. And I made a decision then that actually was not the place for me to do work. I felt very immobilized by that work.
Mm-hmm.
I fully support, and I've met amazing activists and organizers and healthcare providers who are doing work in that space, but that wasn't necessarily the space for me. And that is okay, because not all of us have to be everywhere. And so seeing how our work intersects and connects to other works in the larger system is important, but not being immobilized by it, being able to narrow in and be like, okay, this is what I'm doing today to help the greater good. Like, this is what my focus is right now, and it can always change later. Like, in focusing on that, I think can be comforting to folks.
Yeah, absolutely. I love what you said. And just what you said that really hit me was that you don't have to solve all the problems, right? You find the problem that most resonates with you, and you find people who are already doing the work,
Yeah.
and you join in with them.
Yeah. Yeah, exactly. You don't have to do it alone, and you're not the first one to see the problem. And all of our work can stack on each other and intertwine and connect and support each other. We don't have to reinvent the wheel every time. I know it can feel like because the problems are so big that they need some like big, wild, never before seen solution. But some of the solutions to problems tend to be quite simple, or going back to the roots almost of like, what do people need? Like, people need connection, people need basic resources, people need places to live and water to drink and food to eat. And like, let's look at these kind of basic things and figure out how to get these to folks in the best way possible.
Yeah, absolutely. So for you, having been a nurse practitioner and a doula and a lactation counselor, and moving into health justice and owning your own business, but in between that, you've done work with products, you've done work in health tech startups, you've done strategy. How did you make that switch from clinician to doing these non-clinical type activities, or this non-clinical work?
I think a couple things about that. One is that I almost kind of just got pushed into it. I walked I walked forward and I thought I was stepping into one thing, and then I just stepped right off a ledge onto something totally different. So that's one thing I'll say about it, and I'll speak a little bit more to what that kind of thing was for me. But I also think that one place that health tech has gone kind of wrong, if we're going to just take my opinion for it, is I think a lot of the work that we're talking about is clinical work. It is work that needs to be inherently clinical in nature, like it needs to be done by clinicians. And
Mm-hmm.
we've put it into the hands of folks who do not have the lived experiences of a clinical care provider. And I think that that's a mistake. And I think a lot of health tech companies actually are now realizing that's a mistake. And there is more of a push to include the voices and expertise of healthcare providers. But, I think that, yeah, that's just one thing I wanted to say about that is I think that it is in a lot of ways clinical, even though we talk about it as non-clinical work. I got into it because it just was not working for me anymore in community healthcare. I was working in community health. I was really loving my job in a lot of ways, or I guess I'll say that it was my dream job. Abstractly, it was not my dream day-to-day life. Like, day-to-day, I was getting burnt out. Day-to-day, I was running up against having to being told basically to treat big issues like racism, capitalism, poverty with medication and with a 5-minute visit. And that just isn't feasible. And so I was feeling pretty burnt out. When my son was diagnosed with leukemia during the pandemic, and I went to my supervisor to say, like, okay, I love this work. I still want to treat this population, but I need to do it telehealth because I can't expose him. He's immunocompromised. I just was met with such resistance and inflexibility that I had no other choice but to leave community healthcare in that moment. And I actually only applied to one job. I applied to a women's health tech company. I applied just as a nurse practitioner. I didn't apply for a non-clinical role at first, and they hired me as a nurse practitioner. But what was refreshing about that role is that when I entered as a nurse practitioner and saw some of the issues they were facing in these, so-called non-clinical roles, I started to just fix the problems. I started to be like, hey, this is what you should do for this. This is what you should do. I just started speaking up, using my voice the way I do in any situation. That's very on brand for me. But what I was met with in that environment was interest and excitement to be like, oh, great. Okay, you're interested in this? Like, go run with this, run with that, do this. Like, okay, let's give you the resources to do that. And like, I very quickly, like within a matter of months, moved into building out their entire virtual care team. And that was super exciting and very different than what I thought I would be doing. And I just kind of never looked back from there. That was the first thing that started it off. And I was like, oh, this is great. Like I can make such a big impact doing this work in a way that I didn't feel like by the end of my time in community health, I was really doing on the one-to-one level anymore.
That's awesome. And I want to circle back for a minute just to ask you, how's your son doing now?
Oh, he's great. So he has been completely off treatment and in remission for over a year now.
Oh, that's awesome. Awesome. I'm so glad to hear that. But it's so unfortunate that you were met with that resistance when, before that point, you're a good worker. You've been doing your job. They had no issues with your work. And yet the model that they had didn't allow you to keep your son safe and keep the job.
Yeah, I mean, and what was frustrating extra about it is that we were providing telehealth. We were just providing telehealth in the office because I think that there is this infantizing of healthcare providers sometimes where like we need to be like, we're all adults, we're professionals, we've gone through school, we're entrusted with people's lives. Yet a lot of times there's dynamics with supervisors in which they don't trust us to do our job. They want to oversee us. They want to make sure that we're, checking all the boxes or doing that. And that level of micromanaging for people who are taking care of people's whole lives, like just doesn't work. And I think it's a lot about billing and the pressures of clinics to bill to certain rates and make sure that everyone's billing at the top that they can. But it creates really a lot of times untenable situations for healthcare providers in which, and in a situation that otherwise could have been resolved and you could have retained a healthcare provider who would have stayed with you and been loyal and provided good care and all of that stuff, then you end up just driving them away because of that short-sightedness.
Yeah, so you were doing telehealth, but you literally had to go into the office to then get on the computer to talk to or to do the therapy or treatment or whatever you were doing with your patient.
Exactly, yeah.
Wow, that's very interesting. That is very interesting, but you're right. A lot of times, and I think that's why a lot of professionals, healthcare professionals are leaving the profession or wanting to do something different is because they don't feel like they have the autonomy to do their best work and manage their life. Because long gone are the days where people will just do whatever the employer wants them to.
Yeah, exactly. We've all kind of seen past the like smoke and mirrors or something. I think that a lot was laid bare with COVID too. And I think that like we're just kind of over it. And so I think that employers need to be mindful of that it actually, in the same way that I was talking about health justice, like benefiting everyone, it benefits margins and profit and growth for employers to care deeply about their employees and to take care of them and to support them. Like that actually benefits businesses. And we have lots of evidence to that. So it's a very short-sighted view of how to manage when there's that level of rigidity.
Yeah. And I mean, you're right. COVID absolutely accentuated it. And I think also that we've seen our parents, our colleagues, people that we love get burned by these companies who they've been loyal to for years, and they get laid off or displaced or treated a certain kind of way, and people are just done.
Yeah.
It's a new day for how people are expecting to be treated and handled. And I say handled because that's the word that's coming to me at the moment, but handled by their employers and these companies that they're working for.
Yeah, I totally agree. And I think that's right. I think that's where we need to be headed. Yeah, I think also healthcare professionals are starting to uncover their power and just how many skills they do have, and how integral they are to the healthcare system, a system that's not working for them or their patients, which is what really at the end of the day, healthcare providers at large, like most of the ones that I have met, talked to, interface with, taught, they just want their patients to be well. Like they just want to take good care of their patients. They want to have a positive impact in the world and help people be well. And they see the healthcare system a lot of times as working against that, not with them on that. And that causes a lot of problems.
Yeah. Well, I will tell you, Tesiah, we have talked about a lot in this in this episode. What would you leave the audience with as we kind of end this episode?
Yeah, I would say to kind of going back to something I said earlier, like find your cause and find your people. All of this is going to be way easier, whether it's getting a job or trying to finish a big project or trying to make a huge change in the world. Literally all of it will be easier by connecting with folks who want to see you succeed.
Find your cause and find your people. I love that. We were created to do life in community. Mm-hmm. And when we find ourselves trying to do life alone, it can literally wear on us, right? Because we were created to do life with other people.
Yeah.
Thank you so much for joining me today, for sharing all of your expertise with my audience. And thank you for the work that you're doing.
Thank you. I'm really happy to be here. And I love the work that you're doing. And I think that I think storytelling and sharing is another huge act of community and connection for people. So I really appreciate it.
Thank you so much for listening to the show. It would mean a lot if you would share this episode with a friend or a colleague. I would be honored to encourage them in their journey too.